ஹாய் ஃப்ரெண்ட்ஸ், இந்த வீடியோவில் தமிழ்நாடு ஃபார்மசிஸ்ட் தேர்வு அதாவது MRB தேர்வு 2023 கேட்கப்பட்ட வினாக்கள் மற்றும் விடைகள் தான் இந்த வீடியோவில் நம்ம கேட்டுருக்கோம். இது ரொம்ப யூஸ்ஃபுல்லாக இருக்கும். 2025 ஃபார்மசிஸ்ட் தேர்வுக்கு உங்களுக்கு ரொம்ப யூஸ்ஃபுல்லாக இருக்கும். எப்படிலாம் கொஸ்டின் கேட்டிருக்காங்கன்னு உங்களுக்கு தெரியும். நீங்கள் இந்த வீடியோவை பார்த்து பயனடைச்சுக்கோங்க. வாங்க இப்போ வீடியோக்குள்ளே போகலாம். இந்த கொஸ்டின்ஸ் எல்லாம் பேட்ச் 2 அதாவது 26/4/2023 அன்று கேட்கப்பட்ட கேள்விகளில் பார்ட் 1 தான் இது. வாங்க இப்போ வீடியோக்குள்ளே போகலாம். First question, how many grams of water are needed to make 150 gram of 4% weight by volume solution of potassium acetate? Option A 100, option B 144, option C 130, option D 135. Correct answer is option B 144. Next question, the recommended container for inhalations and spray is option A colorless fluted bottles, option B amber colored bottles, option C wide mounted ribbed bottles, option D narrow mounted bottles. Correct answer is option A colorless fluted bottles. Next question, tetany is due to deficiency of option A calcium, option B magnesium, option C phosphorus, option D manganese. Correct answer is option A calcium. Next question, gluconeogenesis predominantly takes place in option A liver, option B brain, option C skeletal muscle, option D adipose tissue. Correct answer is option A liver. Next question, glycosuria is seen in option A urinary tract infection, option B hypertension, option C diabetics, option D respiratory tract infections. Correct answer is option C diabetics. Next question, pyuria is presence of dash in urine. Option A increased number of red blood cells, option B increased number of puff cells, option C increased number of epithelial cells, option D increased number of platelets. Correct answer is option B increased number of pus cells. Next question, enzymes are dash in nature. Option A fats, option B nucleic acid, option C proteins, option D carbohydrates. Correct answer is option C proteins. Next question, as the concentration of the enzyme is increased, the velocity of the reaction proportionally dash. Option A increase, option B decrease, option C remains same, option D attains 0. Correct answer is option A increases. Next question, the following drugs are used in treatment of malaria except option A chloroquine, option B primaquine, option C aristonate, option D chloramphenicol. Correct answer is option D chloramphenicol. Next question, quartan malaria fever is due to option A Plasmodium ovale, option B Plasmodium vivax, option C Plasmodium malaria, option D Plasmodium falciparum. Correct answer is option C Plasmodium malaria. Next question, which of the following is not a source of surface water? Option A rivers and streams, option B ponds, option C shallow wells, option D impounding reservoir. Correct answer is option C shallow wells. Next question, which of the following tests is used to determine the prevalence of tuberculosis infection? Option A sputum acid fast Basil examination, option B cartridge based nucleic acid amplification test, option C Mantoux test, option D blood test. Correct answer is option C Mantoux test. Next question, what percentage of total calories should be from fat? Option A 10% to 30%, option B 7% to 50%, option C 65% to 80%, option D 1% to 7%. Correct answer is option A 10% to 30%. Next question, burning feet syndrome is seen in the deficiency of option A riboflavin, option B pyridoxine, option C pantothenic acid, option D vitamin B12. Correct answer is option C pantothenic acid. Next question, the neurotransmitter released in the neuromuscular junction is option A dopamine, option B serotonin, option C acetylcholine, option D adrenaline. Correct answer is option C acetylcholine. Next question, loss of sense of smell is called as option A anosmia, option B aphasia, Option C, ageusia. Option D, photophobia. Correct answer is option A, anosmia. Next question, beta cells of pancreas secrete option A, insulin, option B, glucagon, option C, somatostatin, option D, pancreatic polypeptide. Correct answer is option A, insulin. Next question, lipase helps in digestion of option A, protein, option B, carbohydrate, option C, fats, option D, minerals. Correct answer is option C, fats. Next question, antidiuretic hormone act on option A, proximal convoluted trouble, option B, collecting duct, option C, ascending limb of loop of Henle, option D, descending limb of loop of Henle. Correct answer is option B, collecting duct. Next question, the process of transfer of food from the mouth to the stomach is called as dash. Option A, mastication, option B, deglutition, option C, partition, option D, micturition. Correct answer is option B, deglutition. Next question, simple cuboidal epithelium is present in the below mentioned organ. Option A, thyroid follicles, option B, skin, option C, uterus, option D, trachea. Correct answer is option A, thyroid follicles. Next question, lack of intrinsic factor with failure in the absorption of vitamin B12 results in option A, hemolytic anemia, option B, pernicious anemia, option C, aplastic anemia, option D, jaundice. Correct answer is option B, pernicious anemia. Next question, as per the Poisons Act, license is granted by Central Government of India for option A, import, option B, export, option C, possession, option D, sales. Correct answer is option A, import. Next question, All India Pharmaceutical Congress Association was started in option A, 1940, option B, 1932, option C, 1936, option D, 1948. Correct answer is option A, 1940. Next question, Central Register for Pharmacists is maintained by option A, Central Council, option B, Health Ministry, option C, University Grants Commission, option D, Medical Council of India. Correct answer is option A, Central Council. இந்த வீடியோ யூஸ்ஃபுல்லாக இருக்கும்னு நம்புகிறேன். இது போல் இன்ட்ரெஸ்டிங்கான வீடியோஸை பார்க்க நம்ம சேனலை சப்ஸ்கிரைப் பண்ணிக்கோங்க. கூடவே இருக்க பெல் ஐக்கானையும் ப்ரெஸ் பண்ணிக்கோங்க. உங்கள் ஃப்ரெண்ட்ஸ் அண்ட் ஃபேமிலிக்கு ஷேர் பண்ணுங்கள்.